Hi, everybody. Welcome to Impossible Heat Waves. Should everyone have the right to remain cool during a global climate crisis? My name's Mitch Stripling, the director of the New York City Pandemic Response Institute, filling in for Wafa El Sadr. The New York City Pandemic Response Institute is a new initiative, a strategic partnership between Columbia University and the CUNY School of Public Health to enhance readiness across the whole of New York City society and beyond. We have two co-leads, Wafa El Sadr, the director of ICAP at Columbia University, and Ayman El Mohandes, the dean of the CUNY School of Public Health and Health Policy. We really want to welcome you to this important webinar today. Heat waves and extreme heat, as we know, are one of the leading weather-related causes of death. They pose health risks. They have socioeconomic impacts. They're becoming increasingly common due to rising global temperatures caused by climate change. Addressing this issue requires mitigating climate change, implementing new urban planning strategies, and protecting vulnerable populations during extreme heat events. You know, just recently, we've seen this tragedy unfurl around the world. Just this month, we saw extreme heat saturating Texas and throughout the southern United States. We've seen northern India impacted by extreme heat with a number of fatalities over the last few weeks. And all of us here in New York City saw how smoke conditions could impact air quality, which could certainly make extreme heat worse as well. So these are all situations we're going to talk about today. But we're not just going to talk about heat in general. We really want to focus in on solutions. That's what PRI is all about. So to promote resiliency and adapt to these future increases in temperature, cities like New York City are considering maximum summer indoor temperature policies that would ensure that all residents have the right to remain cool and are protected from extreme indoor heat. Policies that would make sure that indoor temperatures never got above a certain degree threshold. So today's webinar will feature a panel discussion exploring how cities around the world can use these maximum temperature policies and other mechanisms to reduce indoor temperatures to tackle the pressing issue of heat waves and climate change. And we'll also talk about how that policy could be implemented here in New York City. So I want to do a quick intro of everybody. The panel discussion today will be moderated by Ilias Kavoris, professor and chair of environmental, occupational, and geospatial health sciences at the CUNY School of Public Health and Health Policy. He's one of our PRI faculty co-leads, in this case for the workforce capacity and preparedness team. So our panel of experts includes Betsy Cable, the code compliance manager from the City of Phoenix Network Services Department, Andreas Matsurakis, the director of the Research Center for Human Biometeorology and Heat Health Warning from the German Weather Service, and Carrie Olson, the Assistant Commissioner of Environmental Surveillance and Policy for the New York City Department of Health and Mental Hygiene, and finally, Abhiyant Tiwari, the lead from the Health and Climate Resilience Program at the for India at the Natural Resources Defense Council. So the impact of climate change and heat waves on our health and the environment persists. We're dealing with it now. We'll deal with it more and more in the future. We hope that this event can inspire action and collaboration among city leaders, businesses, and community organizations on this policy approach. At PRI, we advocate for a whole of society framework to address these public health emergencies and the tragedies they can create. If all of us can come together to solve them, then we can solve them. We can bring better health policies and better health outcomes to our cities around the world. So today, we hope we can use that spotlight to look at cooling ordinances and to see what some specific concrete ways are we can mitigate heat impacts. Finally, I just want to thank Bashar Mackay, PRI's communications director, for all of his work putting this event together. So before we begin our panel discussion, I'm really excited that I get to invite Carrie Olson, Assistant Commissioner from the New York City Department of Health and Mental Hygiene, to say a few words about pursuing health equity informed policy here in New York City. So thanks so much, Carrie, for joining us. Thanks, everyone, and over to you.
Great. Thank you so much. Good afternoon to everybody. And really huge thanks to PRI for bringing us together to talk about this very important topic and creating what I'm really seeing as a learning space for all of us as we move forward and think about solutions. At the New York City Health Department, we've been working for more than a decade now with city partners on equitable approaches to heat adaptation, really trying to think about how we can minimize the known and significant health impacts that heat brings to our city. Primary among our partners has been city leadership from the Mayor's Office of Climate and Environmental Justice. And their focus and their task, among others, is to really think about addressing the significant impacts that climate change has already had and is continuing to make on our city overall. But they also have been incredible partners to us in recognizing how critical it is that we center health and equity in the sustainability and resiliency action that the city takes. And this has become all the more important with the rising temperatures that we're all aware of, as you can see on this graph. This is from the New York City Panel on Climate Change. This unique group is an independent scientific advisory body that directly supports our city through the mayor's office to consider and come up with local strategies for resiliency and adaptation. And their most recent report emphasizes what we already knew. Summers are getting longer, they're getting hotter, and there are going to be more heat events in our future, those emergency levels. So currently in New York City and in most cities in the Northeast, we have temperature-based policies and building regulations that are centered around the cold, our cold winters, which have been very much needed and are important. We have building insulation standards, heating requirements, a wide variety of different approaches to protecting our residents from the cold. And climate change is now really pushing us to shift that paradigm, and we need to be considering summer policies to protect tenants against unsafely hot living conditions. Next slide, please. So at the health department, a big part of what we do is we track the health impacts of heat. We try to understand who and which communities are bearing the greatest health burdens from heat. And then we use those data to improve programs and also inform the policies that are being put into place. Every year we release a heat mortality report, which quantifies the magnitude of severe outcomes from heat and also really illustrates the inequities that we see across our city in climate burden. It also really points to a clear need for systemic and structural approaches to heat mitigation. Every year in New York City, 350 deaths are attributable to the heat each summer. About 1/3 of those are attributable to extreme heat days. So those are the days when there's a heat advisory in effect and when the risk of death is the greatest. You can see that on this graph here on the far right, the line indicating cumulative risk of death goes sharply upwards for the highest temperatures past a heat advisory threshold. However, this leaves more than 200 deaths that are attributable to non-extreme heat when the temperatures are hot, so over 82 degrees, but don't reach those emergency levels. And that's depicted on the chart in the tick marks at the bottom. So the total number of extreme heat days has been holding steady over the last decade, but summers overall are getting hotter. And so not only do we just generally see more non-extreme hot days every summer, we also see that those are increasing in number and have been increasing over the last decade. So robust emergency response is critical during heat waves. We definitely need that, but we also need to be focusing on these larger structural interventions to help keep people safe through lengthening summers. Next slide, please. That's all the bad news, but the good news is that heat-related deaths and illnesses are preventable. Exposure, heat and heat deaths are about exposure to an environmental hazard. So if we reduce the exposure, we're going to reduce health impacts. The best protection is air conditioning. So allowing people to find relief from the heat. Our data show that about 2/3 of New Yorkers who die from heat stress were exposed to dangerously hot apartments without a working air conditioner. And other research, including here in New York City, has shown that indoor temperatures in spaces that don't have air conditioning can be significantly hotter than it is outside. And after it's been hot outside, these indoor spaces without air conditioning stay hot for days after the outdoor temperatures have cooled down. We do have incredibly high prevalence overall in the city of air conditioning, particularly in comparison to other parts of the world. About 90% of New Yorkers have air conditioning at home, but there's clear inequities in who has access. Black New Yorkers and lower income New Yorkers are less likely to own air conditioning, and this reflects structural racism and inequitable distribution of affordable and safe housing and other resources across our city. The maps here, the left shows our heat vulnerability index, which we use to prioritize neighborhoods that have the greatest risk of heat-related mortality. And on the right shows air conditioning prevalence, which is one factor in the HVI. The red neighborhoods reflect the climate injustices and the burden that's carried by our communities across the city. And having AC isn't the only issue. People who need AC also need to be able to run it. They need to be able to afford to turn it on. And we know that a lot of people hold back on using AC because of concerns about their electricity bills. So we're working to pair heat adaptation with our sustainability actions, including thinking about how to provide cleaner and more affordable energy. And we also have to be thinking about strategies to address the urban heat island effect by cooling and greening our neighborhoods and prioritizing those that are carrying those greatest health and climate burdens. Next slide, please. The city has really been laying a foundation for policy and regulatory approaches to summer heat. The New York State Home Energy Assistance Program, or HEAP, is federally funded, and it sets aside money every summer in the summer cooling assistance component to purchase air conditioners for low-income New Yorkers. And our promotion of this in the city has actually led to record use of the benefit last year in 2022, which was great news, but it also resulted in the program ending at the beginning of July rather than running through the summer to the end of August because it ran out of funds. So we've really been looking to HEAP and the federal government to expand funding for this program to really support heat mitigation. And we're actively advocating for our state to offer utility assistance in the summer, as is available in other states and is also available here in the winter months for cooling. During 2020, we went even further to expand access to residential cooling. The city and the New York City Housing Authority, or NYCHA, our public housing authority, undertook an unprecedented emergency effort called the Get Cool New York City or NYC program that funded the purchase and installation of more than 70,000 air conditioners for lower income older adults to protect them against hot weather in the summer while social distancing guidelines for COVID-19 were keeping people in place. In addition, right now, NYCHA is implementing a groundbreaking program called Clean Heat for All in partnership with the New York Power Authority and the New York State Energy Research Development Authority. They're using this opportunity to install 30,000 newly designed window heat pumps into 10,000 homes, which is about 6% of their portfolio. These electric units, which were developed as part of this project, and they will provide both heating and cooling for existing multifamily buildings, and will be part of NYCHA's transition to fossil-free heating sources to increase sustainability. We also have seen amazing work by our Department of Housing Preservation and Development, or HPD. They are pushing forward requirements for cooling through their design guidelines for development projects. They've mandated cooling for all new construction since 2020, and this year's updates are going to require a place of refuge for senior and low mobility housing with backup power for cooling and other critical uses to keep these populations safe during power outages. They're also working to phase in requirements for cooling in senior housing and as a part of building electrification scopes of work in thinking about sustainability in their affordable housing portfolio. Last slide, please. So the city has an ambitious and exciting climate sustainability plan that came out in April. It's called Plan YC. And one of the goals that has been set is to establish a maximum temperature policy by 2030 that will provide protections similar to those that we see offered in our city during the winter months. As first steps, which it really led by our Mayor's Office of Climate and Environmental Justice in partnership with the Health Department and many other city agencies, we're first reviewing temperature thresholds and looking at existing policy examples, and also thinking through how to start with cooling requirements for all new construction. In addition, we have to analyze our existing buildings. So we're really scoping out the readiness of our old infrastructure here in New York City. What is the current AC prevalence? And also, what are the potential impacts to utility costs and implications for tenants? In addition, we have to think about changes to the energy load that may be required for full building cooling through air conditioning or heat pumps. And also, all of this work is being done in integration and sort of speaking to our sustainability regulations, Local Law 97, which put into place building emissions requirements here in New York City. And so as our buildings are working to electrify to comply with Local Law 97, we should see our residential buildings adopting heat pumps and other technologies that can provide energy efficient heating and cooling while moving off of fossil fuels. And then most importantly, we're very actively learning from the experiences of other jurisdictions and talking to many other experts, which is what's going to continue now with this panel. So I'm very excited to turn it over to the conversation now to Ilias and my co-panelists. Thanks so much.
Hey, hello. Good afternoon, everybody, in New York City and around the world. Thank you for joining us in this panel. My name is Ilias Kavouras, and I'm with the CUNY School of Public Health and PRI. So, as Mitch and Carrie explained very well, extreme heat is the #1 weather-related cause of death in the US. All of us have our fair share of experiencing hurricanes, floods, and tornadoes, and all of them. And heat kills more people than all of them. And despite that, people tend to feel more uncertain about what to do under the threat of extreme heat, and don't perceive it as much as a personal risk. So, and this mismatch between the reality of the danger and the actions that people take to protect themselves extend from the individual level as well to the community and to the policy level. So it branches, it extends throughout the human ecosystem. So while the climate is changing predominantly due to a single contributor, and that's fossil fuel combustion, coping and adapting to warmer and extreme temperatures and extreme weather and other events, as we're experiencing now here in New York City with air pollution, but around the world as well. And to cope with those in cooler indoor environments will most likely be the outcome, the cumulative result of multiple actions. Although climate change caused by one, we have to do a lot of things to learn how to live with that at the beginning, and then probably find ways to address it. Multiple actions at the individual level, strategies as communities, and then policies at the government level. And that needs to be adapted over time and around the world, even around New York City. Communities are different, priorities are different, cultures, and the way we see things and experience policies and actions are different. So, and these, there are complex, non-linear, two-way relationships between actions and the human ecosystem, and all of them affect some part of our quality of life, or the way we live, expanding, starting from building and energy infrastructure to environmental resources availability, and from financial assets, as Carrie mentioned, about the ability of people to use or not use air conditioning, although they may already have it, to health, to their health and safety. And many of them, these relationships, they have a tipping point, at which point they're becoming unavailable or catastrophic. A good example of that is what Texas, for example, is experienced or had experienced in the past, with people using air conditioning to cope with the extreme heat in the area, but then the grid cannot afford it, or there is not enough energy generated. So the system, if collapsed, then nobody can use the air condition. So, and as mentioned before, we've seen it in New York City. We've seen it also around the world, in every single place. Both the impact and our ability, and the ability to cope and adapt, varies a lot by age, by race, by gender, by ethnicity, income, and of course, health insurance and underlying health conditions, and which already, which worsens already significant social quality of life and health disparities. So, and heat, as Mitchell mentioned earlier, and Carrie as well, is not by itself. We're in the environment, and we breathe the hot air that also contains pollutants. Typically, ozone is one pollutant that comes along with extreme heat in the summer. It's a summer pollutant. And as we're learning now in New York City, the last month, and people around the world, in California, Western, in India, and in Southern Europe, they learn also with wildfire smoke. And both of these, the combination of that makes a condition, heat waves, that's already bad, extremely, extremely bad. So in order to address those, and we need effective strategies and regulations to cope with heat waves that hold the potential to promote the responsible use of technologies, reduce energy demands and side effects, mitigate adverse health outcomes, and create resilient and livable environments for all. It's very important to focus for all. It seems that the window to act is closing. Climate change has been with us 40, 50, 60 years, and it's closing quickly. And we probably should get most of it right now the first time and optimize it over time. So this is, of course, much easier said than done, but that's why we have our panel today, which is composed of scientists, experts, practitioners around the world. I'm not going to go ahead and introduce them again. Mitchell made a very good job introducing them. I just want to say that our panelists cover an area of 14 time zones around the world, in 3 of the largest economies and population centers of the world, worldwide. So they bring quite a lot of experience and different perspectives in how to deal, how to address heat waves around the world. So let's hear from them. And the first topic we can discuss is what practices and strategies at individual, community, and city level can create cooler, safer, and sustainable indoor environments for all individuals. And in your experience, what is currently being considered and discussed around the world? And we will start with Professor Mazarakis.
Thank you, Elias. Before starting, I would like to mention some specific points. I'm at the moment in Lisbon, and temperature is about 29 or 30 centigrade, which is about 86 Fahrenheit. But I'm not suffering from the temperature, I'm suffering from the humidity. That means when we want to know the implications concerning the effect of heat, we do not consider only temperature. In this context, we try to calculate that or quantify that, bringing together the effect of temperature, mentioned humidity, but also wind. But another factor which is much important is also radiation, because if you are in the shade and you have a temperature of 86 and you will go directly to the sun, you will experience about, let me say, more than 100 Fahrenheit. Another effect that factor that we have to consider are other factors. Elias still mentioned the ozone conditions, but it's not only the ozone condition, it can be also particles like forest fires, where people are suffering a lot. One of the biggest heat waves that we had in Europe was 2010 in Eastern Europe, Ukraine and Russia, where we experienced really much implications. Most of the people think the 2000 heat wave was the biggest one. Another factors which also can affect people are UV radiation. We are exposed also to UV radiation, about sunburn and so on. That means in reality, when we talk about heat, we don't talk about temperature, but we talk about a cocktail of factors. Finally, we don't know which factor is the factor who kills. Concerning the possibilities that we have worldwide, I would like to mention two activities or two possibilities that we have. First of all, we have the Global Heat Health Information Network. This is a network which is under the umbrella of the World Health Organization and the World Meteorological Organization. And there, Abhyant Tiwari is also a member of this network. And here we are looking how to provide information, how to bring people together in order to prepare. This is the one thing which is important. Last year, we had also a G7 meeting that was under the German presidency. And here we talked about early warning systems, especially about heat health warning systems. It's good initiatives. At the moment, the topic of the heat and heat implications are on the top level agenda. I mean, in many countries in Europe. I was on Monday in Berlin together with the Ministry of Health and the Ministry of Environment in order to look about heat protection plans and so on. These are initiatives that we have, and we need that. It has to be top on the top agenda. That the second, let me say, describe it in the way fantastic initiative that we have was the development of the heat health action plans. And if you look to the heat health action plans, the first have been released, or recommendations about that was 2008, 2009, based on the experience of the heat wave in Europe 2003. They include all the regulation, or in reality, a heat health action plan is a tool which wants to help and can help. And if you look on the 8 success factors that we have in the heat health action plans, first is responsibility. Who is responsible and who is managing these factors? And the second one is the heat health warning system. And exactly in the heat health warning system, and this is also a topic that we work in the Global Heat Health Information Network, we have specific factors in order to quantify heat. And we have in the heat health, most of the countries in the world, or the national weather services, have a heat health warning system. The one that we have in Germany includes what I mentioned before, the combination of the effect of temperature, humidity, wind speed, radiation, but also thermophysiology, that means activity of the humans, but also the clothing. And this we combine in order to define thresholds, in order to decide when we will release warnings. We combine this with epidemiological data, and we see an increase in the excess mortality when we have this perceived temperature. We call it perceived temperature, which is in the level of 90 Fahrenheit. But this is not for us the only one factor that we include. We know that the first heat wave or an early heat wave has a more stronger effect. Another factor that we include is the indoor conditions. The indoor conditions, we need that, and we see that there is a stronger correlation with mortality, not only with the perceived temperature, but also with the indoor temperature. This is the reason because in the heat health warning system, we have a model which calculates for elderly and care homes the indoor conditions during the night, because the night situation is the most important one. And it's a matter of fact that we in Europe, especially in Germany, we don't have AC in the private houses. We have this only in public buildings and so on. But these three factors I mentioned are not only factors that we include in the warnings. We include also an urban heat island model. In reality, I'm coming from urban climate. I was working more than 30 years at the university about urban climatology and human biometeorology, and we include this information also. And the other last factor that we have is the conditions for elderly people. We know that elderly people react on heat later than younger people, but concerning extreme heat, they react earlier. This gap for elderly people between feeling good and collapsing is very, very small. And this is about 95. It's lower than the skin temperature or the body core temperature. All these factors, it's included in the heat health warning system. So we release the warning, but this is not the only one that has to be done. This warnings has to be communicated, and we communicate small, simple recommendations, but it has to continue. And we are running the warnings based on administration agreements that we have with the government, with every federal state in Germany. Other weather services in Europe have a more simple system. UK is starting this year an impact-based forecast. The same Switzerland. France has a more simple model, taking the three days temperature adapted during the year and so on. But this is not the problem. The problem is that, as I mentioned, not only having a heat health warning system, but knowing what happens indoor. And we know that indoor, the problem is during the night, especially in the cities. Cities that's much warmer, about 3 centigrade in the context of a year than the rural areas. But the indoor conditions, it's much more complex. And in order to do that, we provide all the information in cooperation with the ministries, with the authorities, about how to cool that. And in Germany, taking the example of Germany, we have the working regulations. That means if we have a temperature of 79, actions have to be taken, but it's not clearly defined. If we have a temperature of 86, that means if you're in the working conditions, the boss or the employment has to provide strategies, possibilities, like providing water or any other things. And at a temperature of 95, in reality, the work has to be stop in indoor conditions. But what can we do for that? We cannot stop the work. We cannot stop the industry in this context. And therefore, the recommendation is to have recommendations which everyone can do something, like avoiding heat indoor. But the indoor heat is taking place because of the outdoor. That means all the things that we know about the effect of sun radiation and the exchange of ventilation exchange has to be done. The recommendation is close windows, provide shade, and if you want to ventilate, if you need ventilation, it has to be done when the air temperature outside is lower. And then we have the regulations that I mentioned before, and we have from the governmental side the heat action plans, which are really the best instrument we can do. I mentioned management coordination, heat health warning system, indoor conditions, but they include also more factors. And we have something like education for medical or health sector, recommendations for vulnerable groups, but also the long term. What can be done in order to reduce heat in urban areas, especially also in the indoors, that means with urban planning recommendations. And the final, and this is the factor 8 that we have, is the monitoring of all the actions that have to be taken, and then also evaluate them. And at the moment, the gap, or let me say the biggest challenge that we have in that is the implementation of actions, but finally also of the monitoring. And this is exactly what, especially in Europe at the moment, many cities are trying to produce yet action plans, to have a climate adaptation strategy, and so on. But most emergency factor that is we have to change the conditions outside in order to avoid the indoor heat. And this can be technically, this can be by natural based solutions, but it can be also individual level about behavior and how we deal with, let me say, how we manage the day. Thank you.
And let's see what other cities do. Ms. Cable? You can unmute yourself.
Sorry about that. I don't believe I really can add much more to what Professor indicated. I can certainly talk about considerations to think about and stakeholders to involve in the implementation of a cooling ordinance, like what the city of Phoenix has and has had for at least 15 years. So first off, the city requires that any tenant occupied structure that has a ducted cooling system has to maintain that ducted cooling system in good working order. And good working order has been defined as cooling all inhabitable spaces, which would be bedrooms, bathroom, kitchen, and a living room, to a minimum of 82 degrees, which, you think about it, 82 degrees is still fairly warm, but 82 degrees here in the city of Phoenix, on what I like to call the surface of the sun, actually is quite pleasant when you come in out of 110 plus temperatures. So I oversee the team that is tasked with conducting these inspections when we receive a complaint about the cooling not meeting the code requirements. And first, what I want to say is we only deal with tenant occupied properties for this code. And we always ask that the tenants contact our landlord tenant counselors, who provide counseling to tenants and landlords about their rights and their options when dealing with situations. For the tenant, they must notify the landlord of the issue with the cooling system or any other issue, because we deal with many other items inside these residences. But they first have to notify the landlord, so the landlord has an opportunity to fix the problem. When the landlord does not fix the problem, that's when we get involved, and we deem these inspections as hazard inspections, especially in the summertime. And we strive to conduct an inspection within 24 hours of receiving that complaint. If the complaint comes in on a Friday, we do not let that case sit. It is addressed that day, and if violations are documented and noted, then we issue a notice of ordinance violation that has a 24-hour time frame associated with it. And we get that into the hands of the property owner statutory agents, property managers, whoever we can find to serve with that notice. Then the conversation switches to how do we ensure the safety of the individuals living in their home that is suffered some type of cooling failure, right? Whether it's just not functioning at a level to provide for the minimum cooling requirement, or it is just stopped working altogether. We talk to the tenants about any options that they may have available to them. Is there some place that they could go stay? Somebody else they can stay with, a family member, a friend, a hotel. We talk to the landlords and ask them, what kind of mitigation can you provide to the tenant until you can get the system repaired? That might be a hotel stay paid for by the landlord. It may be a portable air conditioning unit. And I will say that most of our housing stock has ducted HVAC systems. We don't have window air conditioning units really at all. And in fact, in most cases, they're not allowed by code. So, but a portable unit can be brought in and it will provide cooling to at least one room in the home where individuals can go and have some relief from the heat. I was looking at our temperatures for this week, and we're going to range from 106 as a high to 114 as a high. And the lowest temperature is going to be 72 degrees, and that is at about 3 o'clock in the morning. So as you can see, and as the summer progresses, it is not uncommon for the temperature to remain over 100 degrees, even at 2 o'clock in the morning. So it is very important for us to try to find a way to mitigate the failure of the HVAC system for these tenants to keep them safe. We also provide them with all of the information that we have available for heat relief locations. We, every summer, designate specific locations throughout the city for heat relief, and we really try to target all areas of the city, and especially those that are of lower socioeconomic status. They're the low to moderate income areas that have been identified in the city. So we use our community centers, our libraries. We also have people out on the street that they have water for people to try to mitigate the deadly consequences that can come if people do not have mitigation to the heat, right? If they don't have anywhere where they can go to get cooled off. So if you're considering drafting a code, I will tell you that our code does not require any mitigation activities. And if I were writing a code today, I would really want to put that in writing and whatever it would look like for your particular circumstances in your area. I think that's very important. We do a good job of convincing the landlords to look out for the greater good, right? To do what is right and to help these individuals out. I would also add some type of preventative maintenance program. We don't have that. And oftentimes we see if preventative maintenance had been done on a routine basis, even maybe twice a year, the failures that we see may have been prevented. I will also tell you that the pandemic has, as we all know, there are supply chain issues, and that has really impacted building owners' ability to get repairs completed from the lack of parts readily available, even the lack of skilled tradespersons to be able to perform the repair work. So it's all very important, right? If we can maintain the systems ahead of time before the summer really kicks in, the catastrophic failure that we see throughout our summertime, which by the way, runs from about June through October. We're still over 100 degrees in October. Those are things that I can think of. There are also some unintended consequences that the team has to deal with. Although our housing stock is relatively new compared to other parts of the world and definitely to the east, sometimes we come across residential properties that are in such disrepair that we have to bring in our building inspectors. And there are times when we have to deem the property uninhabitable. So here's a tenant who is merely trying to get repairs done to the home that they live in. And now the city is coming in and telling them that you cannot stay here anymore. It is not safe. So it happens. It doesn't happen often, but it happens. The landlord tenant counselors are in our human services department, and they have some temporary housing available. They also have counselors and caseworkers that can work with the tenants if this happens to try to help them find new housing. We have lots of programs to help them with down payment assistance, etc. So our two departments work hand in hand when we run across these unfortunate circumstances. I'll also tell you, we always tell the tenants, do not stop paying your rent, because non-payment of rent, at least here in Maricopa County, can lead to evictions. And of course, that is not what any of us want to see happen. So I know the landlord tenant counselors advise them to absolutely continue to pay their rent, but we do too. So then let's move to the enforcement side on how you prepare a case to go through the enforcement process. So our code outlines how the temperature measurements should be taken. It says from 3 feet above the floor, the center of the room, etc. We use a thermometer that records the temperature, but it also records the humidity, which the humidity can be a compounding factor, right, with the temperature. And then we have our written notices that we provide to the property owner. And our notices are very sternly written, I will say. We have about a 94% compliance rate just with that letter. So it tells them what they need to do, it tells them when they need to have it done by, but it also tells them what the consequences are if they don't. Now, I did talk about that 24-hour notice of ordinance violation, and I also talked about supply chain issues. We will grant the responsible party more time as long as they demonstrate that they are doing everything that they can to get the cooling system fixed in the unit. I can give you a multitude of examples, but in some of our larger complexes, they run off of a chiller system. And we've had catastrophic failures of the complete system, which means all of the units in the multifamily housing setting have no cooling. Sometimes that's 200 units, sometimes that's 500 units. It's a lot of people. They have brought in truck-mounted chillers systems, and they basically piggyback off of the system that has failed, and they're able to provide cooling until they can get the main system fixed. So lots of brainstorming, lots of problem solving that goes on. But at the end of the day, we strive to make sure that repairs are in the works. Who is the repair company? When are they going to be out? Have the parts been ordered? When are the parts due to come in? And we ask for the repair company because we want to be able to substantiate what the property owner is telling us. So we will call the repair company and find out if everything that we're being told is accurate. And when we're able to determine that the property owner is doing what they can to correct the problem, we don't have a problem adding or providing them with more time, right? The 24-hour notice is really meant to get them to get the repair process started. We don't ever really expect that the repairs will be completed within that 24-hour time frame, but we do want that process started. I don't think I can really add any more to that.
Thank you very much. Appreciate to see the what's happening in Phoenix, which is an area that experience high temperatures. I mean, 100 degrees, it's cool. It can be cool there. So, but let's move to Mr. Tiwari, and as you give us an overview of what is being considered, discussed around the world, and particularly India, could you please also address what are the key considerations, stakeholders, and mechanisms that need to be in place to implement cooling practices and policies? Mr. Tiwari?
Yes, thank you so much, Elias, and thank you so much, Betsy, for that brief introduction about the cooling ordinance of NYC. I also must thank the organizers, Carrie and my friend Andreas here, for highlighting the importance of minimum temperature here. So it's not the temperature that kills the people, it's the heat that is killing people. And when we talk about heat, it's the heat load. When the minimum temperature and maximum temperature both remains, towards the higher side, that is what makes it really uncomfortable for people to cope with the heat. And when the minimum temperature rises, which means the nighttime temperature rises, that is the point where such cooling ordinances and regulations or building codes come into the place, which are still lacking in most of the part of the global south, which is getting more affected by extreme heat, including India. What happened in the northern northeastern part of the largest state of India recently, in India, in past in past couple of weeks, is that both the maximum and minimum temperature remained high above the average by 3 to 5 degrees Celsius. So when the daytime temperatures were hovering around 100 110 to 115 degrees Celsius, the nighttime temperature was also hovering around more than 85 degrees, 100 and 110 and 115 degrees Fahrenheit. The nighttime temperatures also remained above 83 to 85 degrees Fahrenheit. Now just imagine at that high temperature and that region centered around with two larger rivers of the India contributing the humid heat, with no indoor regulations to control the thermal comfort, like how we had this NYC's cooling ordinance. We do have building codes, but there is an issue of implementation. There is an issue of enforcement across many places. So in that case, what becomes important is how we protect our vulnerable communities. And that's where, heat action plans, which were earlier seen to be just, an early warning systems that tend to protect people and their health from the sudden spike in the temperatures by alerting people and advising them do's and don'ts and what they should do and what they should not do. Initially, with now, also including long-term, short-term, and long-term measures like cool loop, implementing cost-effective, low-cost interventions that communities, the poor communities, particularly the slum communities, can also adapt to cope with the indoor heat, particularly. So cool roof is becoming something significant also in India recently. We started, piloting cool roof with the first heat action plan in India in the western part of the country. in Ahmedabad under the Ahmedabad heat action plan, but that also got scaled and piloted in several other heat action plans, and also got a shape of a statewide policy recently that also my organization NRDC contributed as a technical partner in devising and implementing that policy in the southern state of India, Telangana, which is again a heat-prone state where we have seen massive impact of heat in 2015. So that state became the first state to implement a statewide cool roof policy, where they have set targets. For example, in next 5 years, the policy tends to cover more than 300 square kilometers of cool roof of rooftop area under the cool roof policy, and not all the cool roof, all the rooftop areas, but they have that staged implementation, like how they'll be implementing this in the slum areas, and how they'll be implementing this in industrial and commercial areas, and how they'll be implementing it in residential areas, and in what ways the cost will be covered to implement these policies. So these kind of interventions are also coming up, and not just these, but recently another heat action plan launched in the western part of the country, in the state of Rajasthan, in Jodhpur, which is very close to the Thar Desert, which is extremely hot during the summer. There, the city, non-profit organizations like Mahila Housing Trust, which are driven by women, are working with the city authorities, this urban local bodies, in implementing such solutions at the slum levels, at the vulnerable community levels, and the communities themselves are taking measures. The women, vulnerable women themselves are taking measures to implement such, adaptation solutions, which can not just help in providing the indoor thermal comfort, but also can help in reducing their energy cost and improving their productivity, and obviously protecting their health. So these kind of solutions are being put in place, but we need them to get scaled at a much larger level than they are what they are in the current state.
Okay, thank you. Actually, all of you mentioned what has been done, and of course the chief outcome here is to decrease the temperature or the heat we're experiencing, with the benefit of improving our health, or at least not suffering from the heat. So now, in your experience, what do you see as the risks or unintended consequences of implementing cooling policies or regulations? And then how do you think we can evaluate the effectiveness of these strategies, not only by decreasing the indoor temperature, but improving actually health outcomes and quality of life? Where is I missed Andreas, Professor Mazarakis?
Okay, thanks. I think I will be very short here in my answer. I think first of all, that we need is a good, reliable, easy, understandable information and communication. And there are some risks in that, because we have to separate between two factors. The one is the people who are exposed to the heat and cannot react, like elderly people or ill people. They need help. And the other one is we should or have to protect all the people who are working in the protection or in the care. It can be the whole health sector, like physicians, like people who are working in the hospitals, emergency services, also fire departments. We need, I think, a clear, not only communication, but a good education strategy during the heat wave. Also communication before the heat wave, the beginning of the year, starting the season, then during each heat wave, but also a post-processing what happened in that. And there are two possibilities that we have here. The one is asking about regulations. We have something like that I mentioned before, the heat action plans. The other one is what can we do? What can we do? What we provide in the recommendations, what I mentioned before, is when we release the warning, we are recommending the people appropriate taking of water, not drink a lot, appropriate water taking, reduce your activities, avoid the sun, personal exposure. That means don't go outside. That's the one factor. The other one is keep indoors cool. And when we have extreme heat, we also recommend the people care about others. That means neighborhood help. I think all these factors have to bring together, and many things can be happen. That we have wonderful examples for that about strategies that have been developed. I can recommend the heat action plan and the climate protection conditions what Vienna has run in the last 20, 25 years. They had implement or produce a heat action plan last year in 3 months. That means things are still existing, and how to bring this together and provide, and of course to check the conditions how will be the next year. That was exactly the recommendation that we had from the ministry on Monday. We want to have actions, but they have to be updated every year. It's an issue. It is always on. It's an all-year agenda. I mean, heat. Thank you.
The continuous battle. Ms. Cable, you already mentioned some of the unintended consequences, but in the bigger picture.
The big picture is just communication, right? We utilize our a multifamily housing group to get out information ahead of the summer months to, one, educate tenants about their rights and the fact that this program exists, that they can call and they can have somebody come out and conduct an inspection when there's a failure. And hopefully we're able to get the repairs made for them in a timely manner. The other thing I think is just to really push out the information about heat relief locations, especially, and then like public transit routes to those locations, so that people are able to get relief, because that's really, at the end of the day, they need to have some relief so that we don't have a bad outcome. But other than that, I don't think I can add any more. Carrie?
Yeah, Carrie?
Yeah, I really appreciate all of the different observations, and I really like that we're raising up this idea of sort of community level resiliency and how we need to be thinking at a hyper local level about communicating to neighbors and family and friends, all of these important messages that we have. I think one of the risks that we've spent a lot of time thinking about, and I'd be very interested in what others are doing, is this challenge of message fatigue. So we're having more and more heat events. We're talking about summer temperatures being constantly hot and potentially dangerous. And so I think really leaning into, as both Andreas and Betsy were saying, sort of leaning into an ongoing education. It's not only at the heat event, it's not only during the summer, but we're sort of constantly trying to communicate the importance of staying at safe temperatures. So that's one thing that we've been thinking a lot about. The other thing that I wanted to throw out there as a risk, or something we're spending a lot of time thinking about, is we really, you know, through all of this, we're always thinking about how to prioritize and how to really focus in on those most burdened and the most vulnerable to these events, which the action plans and things that everybody's been sharing are really focused on. And I think that the intersection with the power grid and potential of power outages is incredibly important. And so thinking about how those most vulnerable populations that frequently, you know, hopefully are in situations which might have, you know, indoor cooling, might have those things. If there's a power outage, how are we going to help support those populations and really make sure that we can try to prevent more extreme health outcomes?
Abhiyan, your experience?
I'll probably pick from where Carrie actually left about the power outages. You know, I would rather say there shouldn't be a power outage in the areas where the vulnerable communities reside. So we need to know that. So our heat action plans must need to, you know, identify where the vulnerabilities are. So there should be a vulnerability assessment done for all cities, right? B, the major, you know, big point that I would like to highlight here, which can also address this issue of power outages or ensuring the consistent power supply, water supply for that example. You know, we should think about the global south, which is more vulnerable, which is at the higher risk. There is, I mean, heat governance is missing across the world. You know, there are limited countries now that we have, you know, these chief heat officers and heat regulations and heat bills coming in, extreme heat bills coming in, but it's still missing. I believe in US also heat is not considered, despite being the #1, you know, natural killer. It's not considered by FEMA. It's not considered as a disaster. So there are, you know, certain relief opportunities that cities, that states and cities can miss to tap on for extreme heat as compared to other disasters like hurricane or earthquake, for that example. So heat governance is something that we really need to push in, considering, you know, heat becoming you know, more intense, more severe, and more frequent by every passing year, breaking all the records of the past. That is something that as a science and policy community, we must, you know, ensure to advocate for. That heat governance is something that our policy leaders should think about. And when we talk about heat governance, they should ensure everyone is, you know, made aware of, everyone is accessible to the early warning system. Early warning for all, which WMO has called it for. Everyone has access to healthcare facility during extreme heat days. Everyone has access to electricity, particularly vulnerable communities have access to safe drinking water. So these kind of measures need to be covered through governance, or else it's all going to be on plan and guidelines, but will not be enforced until and unless they're not governed and ruled or backed by the rules and regulations. So that's something I see as a big picture and an important picture in current time and time to come.
Yeah, thank you for mentioning the communication and education in the era of misinformation and disinformation, and climate has been on that forefront for a long time. So it's very important to actually educate our constituents and our communities and our neighbors about this. So I think we have time for, thank you very much for your thoughtful feedback, some questions, and we'll start with the first one. I think that probably goes to Carrie. They were asking whether the New York City Cooling Center Finder can be available before a heat emergency so that people can prepare for that. It's something that has been mentioned in the discussion as well. So how do we proactive, not reactive?
Sure. Yeah, I really appreciate the question. It gives me an opportunity to speak a little bit to the city's heat action plans, and as we've heard about some of the other places. So one of the things that the city does when there's a heat advisory issued by the National Weather Service is we open or make available our cooling center finder and cooling centers across our city. That's managed by our New York City Department of Emergency Management, and so they do, as the person who posed this question, they do have a finder. It's great, so people can go online and they can find a place near them. But that finder is activated specifically when there is an emergency, and the reason for that is part of that process is making sure that these public spaces, before they are put onto the finder, are 100% ready to have their doors open and have air conditioning, cooled environment. And so, but however, these are all public spaces that are actually available all the time. So a huge number of the cooling centers are actually our public libraries. They are our older adult centers. So there are spaces that are publicly available and cooled under many circumstances. And we encourage folks to visit them not only for their cool environments, but for the programming and different things that are offered there. And then in that heat emergency, we are then publicizing and making sure it's very easy for residents if they need to find that quick relief, even for just a few hours. We know that getting some relief from the heat can reduce your risk of health outcomes. And so then we put them up in this special finder. But all of those spaces, or the majority of them, are public spaces that are usually open anyway.
Okay, so there are a couple of questions that relate on the impact of indoor cooling initiatives on the infrastructure, and one has to do with what the question is about hospitals, but what big facilities or other buildings that require power can do to maintain higher power demands in order to keep a constant cooling temperature. Because if everybody is asking for more energy to maintain the cooling temperature, then there is a capacity problem and demand and needs and the need. So what they can do to maintain that they can maintain operations and provide a constant cooling temperature. Probably this is a bigger question. It goes back to diversifying the portfolio of energy resources. It doesn't need to be fossil fuel combustion. It doesn't need to be centralized. In many places around the world, buildings can have their own solar panels on the roofs, or they can use other resources or ways to conserve energy. You have anything to add, Andreas, Tiwari? What big energy consumers can do to maintain their power and cooling temperature in their facilities?
Natural solutions. I think this is one possibility, but this is different from, I would say, from region to region.
Yeah.
I think it's a question which cannot be answered appropriate. But I think finally it will be when we have a collapse of the energy system during heat waves. Yeah, there will be a priority first hospitals and so on. But as far as I know, and we just have equipped the university hospital in Freiburg with 70 indoor sensors. Not all the area is with air conditioning. This is the problem that they have. I think for the hospitals, this will be one possibility, but I think especially in our region, for private houses, the recommendation will be also start to be more effective in your energy use. And in some other regions, And I think cooling is also very expensive, maybe also not possible. Maybe Abhiyan can tell something about the woman working and having not possibilities to cool. Abhiyan, I'm mentioning the one article that you posted yesterday.
Yeah, yes, Andreas, actually, that's what I, in fact, mentioned in my previous comment about the Jodhpur detection plan, where the women, driven self-help group that works with the vulnerable communities, particularly the slum women, are addressing this issue of indoor heat. But what, Elias, you are talking about, the demand at the larger institutions like hospitals, the cooling demand. I mean, uh, the district cooling centers are something, being seen as a solution to that, but that also had to be driven through clean energy and not by fossil fuel, powered energy. India is trying to set up such examples uh, of district cooling which are more efficient. But yeah, I mean, solar district cooling, district cooling empowered by the solar energy is something that we can see as a solution here. But that has its own challenges. The implementation and the business model has its own challenges. I don't think this is the place we can discuss this in detail over here. Yeah.
Mm-hmm. The next question, I think it's been already mentioned and kind of translates what we've seen, that, for example, in Phoenix, they already have a cooling ordinance. In New York City, we're thinking, and that has to do with heat being the way of life in Phoenix, and now we're learning to live with heat. So the question is, what could be the policy avenues for indoor cooling in housing in places where it does not exist? When this related policy infrastructure does not exist. So how do we implement these policies, indoor cooling policies, in places that traditionally did not experience this in cooler environments like New York City, for example? So, Carrie?
Yeah, I mean, this is exactly the question that we're grappling with, so appreciate it very much. I also just wanted to add to the previous question quickly that I think that Abhiyan, your comments earlier, and I think also on Andreas, around the importance of sort of pairing sustainability options with sort of mechanical cooling or whatever all of our things are, like the cool roofs. Like if you're talking about a huge facility, we need to be thinking not only what are we going to do in extreme heat and how are we going to deal with the energy demands, but are there also, natural solutions and other things that we can be doing for these facilities that are sustainable in nature. For the policy, I mean, I think that the broad strokes, the approach that we're taking in New York City, as I outlined earlier, is really leaning on the existing policy mechanisms that we have here for the cold in the winter, right? So right now in New York City, there are protections in place for tenants in residential settings to say that landlords must keep those apartments warm enough in the winter months. So there are minimum temperature requirements. And so what we're thinking about is how do we create and sort of adapt those types of regulations and enforcement mechanisms, building on examples like what they've done in Phoenix and in other places for the summer months. And they won't and can't be exactly the same. And of course, the infrastructure has to be such that it can support the approach. And so we're really looking at that as sort of a stepwise progression, starting with newer construction as a first place to start a new building and requirements there, and then broadening that out over time. And really, again, sort of related to the last question, making sure that all of this is in lockstep with sustainability work as well, right? So, you know, indoor cooling is not a silver bullet. It's not the only thing that we need, and we need sort of broadly to be thinking about, you know, those emergency responses, the greening, particularly in our under-resourced areas, cool roofs, etc., and really thinking about a holistic approach to this issue of the urban heat island effect that we're experiencing here specifically, and more broadly around the world, as was raised earlier, sort of heat governance. How can we really be adapting in a coordinated and intentional way at the policy level?
Yeah, and to that extent is actually the next question is actually for Betsy. And as you mentioned the process that you guys go to deal with catastrophic failures and help the individuals. Do you collaborate with local utility companies to anticipate and plan for potential power outages? Because as you mentioned, these things tend to happen on Friday.
Yes, they do. Most of our failures are not based in a power grid failure, luckily. And to make a very short answer, no, I do not collaborate, but I probably should. And so thank you for bringing that to my attention. We have two public utilities here who operate the grid and provide the electricity, solar, wind power that will power the cooling for every home. But no, we don't collaborate at all at this point, really. At least I don't in my enforcement realm.
Okay. Hold on, there is for the research. Yeah, the next question is kind of broader. I think it's been mentioned earlier by Carrie, touched it a little bit, and then Andreas mentioned that the interplay between extreme heat and air pollution. So, and the question is, should we, in our way of addressing both, actually, should we be looking on how to implement or how to use different plant species in urban development as a way to mitigate heat, as well as reduce air pollution, probably through ozone? Would that be, could that be, or should that be a part of the solution? Andrea?
Maybe a small part. Addressing vegetation, it's a very good and strong issue, but cannot solve all the problems. I think when we look about the urban heat island, the factors that we have to consider is, and that's fact, the city has more surfaces, and these surfaces absorb, and the energy is kept. That means there we have to focus. Having more trees and vegetation, it's a good possibility, but we have to separate between, let me say, trees in forest and urban trees, because this is different. And I think it has to be the appropriate trees that we need. It makes no sense here in Germany to take the trees which are coming from Mediterranean. It has to be more regional tree, but they are more drought resistant. But this means that we need, in this context, a round table, and this is not only people who are coming from science, but also from administration, like, let me say, the urban gardener or the responsible people. To be honest, I learned, I was in the forest faculty for 30 years, but concerning climate change and what trees are the best in order to survive in, let me say, in urban parks and so on, I learned a lot more from the people who are responsible in the gardening. That means, and that it's clear we need something, a good exchange, and what is, let me say, possibilities which can implement it, and also are easy to implement, and it's not so much cost effective. I mean, not so much expensive.
Yeah. And the next question is actually brings something that's been mentioned. How should we deal? And because this is going to be a solution that involves a lot of moving parts, how do you deal, or what problems and risks are with solutions that fall under the responsibility of more than one government agency, health, energy, housing, transportation? So how do you deal? How do you bring? Already Andreas mentioned we need to bring people on the same table and discuss about these things. But in your experience on thinking or implementing these policies or initiatives, how that worked, and what you will do differently if you were to do it all over again? Diwari, Abhiyan?
Yes, in fact, that's very interesting question, and that's the question that the heat action plans are been trying to address. So when we talk about heat is no one's baby, but it is, nagging everyone, right? It is affecting the health system, it's affecting the transportation, the energy, the communication, and you name it and you have it. Like by every passing year, a new sector is coming in into the heat action dialogues that they are also getting affected. We have seen rail tracks getting, uh, you know, destructured because of the rising temperature. We have seen tar roads getting melted because of the rising heat. Apart from the impact on the health system and other key sectors. So heat is everyone's baby. What heat action plans are trying to do is to bring in all the key sectors at one place, which otherwise work in the silos. So far, in my best understanding from Indian experience and also part of the experience from US also, it has been heat action plans are trying to bring in the sector of health, the sector of disaster risk management, to some extent, infrastructure, and other education, sector, but not all. But with every passing year, when the heat is affecting other sectors of the economy, agriculture, power sector, transportation sector, they are also coming in. And that's where I again re-emphasize on the point that I made in my previous comment, is where the governance, role of governance comes in. So if we have regulations, if we have bills and acts in the place which can enforce, which can make an agency a nodal agency and help provide that agency rights to enforce other sectors to implement their actions or have their roles and responsibilities, that can solve the purpose to much larger extent than having heat action plans on the paper but not getting them implemented. Recently we had a one of our institutes in India did a study on 37 heat action plans in India, where they found lacunas in the heat action plans. But those heat action plans are still the paper heat action plans. They are not the heat action plans which are implemented. So there is a gap between what is there on the paper and what is implemented. The implementation will only happen when it is enforced. So this is something we, or at least, monitor and regulated. So this is something we need to bring into the consideration. Yes, Andrea.
Okay. Yes, Andreas?
Yeah, in this issue, I think maybe we can think about the role of multipliers. That means one is responsible, it can be administration, it can be authority, and this have to be, and they are responsible in order to inform other or take actions and so on. This is the one point. The other point is we have to make clear concerning heat. There is no sector or no, let me say, office in a city or bureau which is not involved in that. Thanks.
Yeah, thank you. We're about time. I think we spent the last 1.5 hours on a topic that probably needs many, many hours to discuss and try to understand around the world. And that's city-specific, community-specific. So I would like to thank the panelists for taking the time early in the morning or late in the evening to join us and discuss about this thing, this issue. I would like to thank every single one of you and PRI for hosting this event. I think dealing with heat waves, it involves a multitude of solutions, from warning systems, support system, education, communication, and everybody needs involved. It's not it's not a single task, it's a community task. It takes a village to solve this problem. So with that, I'd like to remind you that this webinar is brought to you by PRI, which is a public health resource that brings diverse organizations, institutions, and communities across New York City together to support cohesive and comprehensive preparedness network that is poised to optimally respond during a health crisis. The Institute is led by Columbia University and its key partner, the CUNY Graduate School of Public Health and Health Policy. And our mission is to advance racial equity, build resiliency, and promote public health preparedness throughout New York City and around the globe. And we seek the advice around the world for that. You can find more about us at the PRI, visiting our website and following our social media. So thank you very much to all the panelists for your time and your knowledge, and we'll definitely follow up with you. And thank you, the audience, for taking time out of your busy schedule to attend this webinar. Thank you very much. Appreciate it.
Bye-bye.
Thank you. Bye-bye.
Thank you very much. Thank you, Andreas. Thank you, Diwar. Thank you, Betsy. Thank you, Carrie.
Thank you.
Oh, we need to follow up because we need to act on this. There are a lot of things happening.
Yeah.
On
that was